EP47, How to Reduce Joint Pain Without Surgery. Joint pain is one of the defining physical experiences of aging for a large proportion of older adults. Knees that ache going downstairs, hips that throb after a long walk, hands that are stiff and painful in the morning. The gradual restriction of activities that once felt effortless. Osteoarthritis, the most common form of joint disease, affects over 32 million Americans, and over half of adults over 65 have some degree of it. But here's what the research consistently shows. The relationship between joint deterioration on an X-ray and pain experienced is surprisingly weak. Many people with severely damaged joints on imaging have little pain. Others with mild structural changes have significant pain. This means that pain is not just a structural problem, and it means that there is often substantial room to reduce joint pain through non-surgical strategies, sometimes dramatically. Today, we're covering the most evidence-based non-surgical approaches to joint pain management. Osteoarthritis is a whole joint disease, not simply cartilage wear, as it was once described. It involves the gradual breakdown of cartilage, the smooth, low-friction tissue covering joint surfaces, alongside changes in the underlying bone, joint lining inflammation, and ligament and muscle changes around the joint. Risk factors include age, excess body weight, which dramatically increases load on weight-bearing joints, previous joint injury, repetitive joint loading from occupation or sport, muscle weakness, and genetic predisposition. The key insight for management is that osteoarthritis is not a passive, inevitable deterioration. It is a dynamic process influenced by load, inflammation, muscle support, body weight, and activity. Each of these is modifiable. Exercise is the single most evidence-based intervention for osteoarthritis pain, outperforming many medications in head-to-head clinical trials and with none of the side effects. This surprises many patients. But won't exercise wear the joint out faster? The research answer is clear. Appropriate exercise does not accelerate joint deterioration and consistently reduces pain, improves function, and slows disease progression. How exercise helps. Strong muscles act as shock absorbers, reducing the load transmitted to joint surfaces with every step. Exercise stimulates synovial fluid production, the joint's internal lubrication. It reduces systemic inflammation, and it improves proprioception, the joint's self-sensing ability, which reduces the risk of injury. Low-impact options. Swimming and water aerobics provide cardiovascular and strength benefits with near-zero joint loading, ideal for those with severe pain. Cycling loads the knee very differently to walking and is well tolerated by most people with knee osteoarthritis. Tai Chi has strong evidence for both knee and hip OA pain reduction. Strength training. Quadriceps strengthening is the most studied intervention for knee OA. Strong quads reduce the knee joint contact force with every step by up to 30%. Even basic home exercises, straight leg raises, seated knee extensions, step-ups, produce meaningful pain reduction within 6 to 8 weeks. Start slowly, particularly during a flare. Even 10 minutes of gentle movement is better than rest. Every pound of body weight generates approximately 4 pounds of force across the knee joint with walking and up to 8 pounds during stair climbing. A 10-pound weight loss, therefore, reduces the load on the knee by 40 pounds with every step taken. Multiple clinical trials confirm that weight loss is one of the most effective joint pain interventions available. The IDEA trial showed that older adults with knee OA who lost 10% of their body weight had 50% greater reduction in pain and significantly better physical function than those who lost less. Weight loss also reduces systemic inflammation. Adipose tissue, particularly abdominal fat, secretes inflammatory cytokines that drive joint inflammation throughout the body. Anti-inflammatory diet. There is strong evidence that dietary inflammation drives joint pain. Reducing ultra-processed foods, refined carbohydrates, and excess omega-6 fats while increasing omega-3 rich foods, fatty fish, walnuts, flaxseed, and polyphenol-rich foods, berries, extra virgin olive oil. Turmeric measurably reduces inflammatory markers and joint pain. Glucosamine and chondroitin have modest clinical evidence for symptom improvement in knee OA. The GATE trial showed significant benefit compared to placebo in those with moderate to severe pain. Effects take 6 to 8 weeks to become apparent. Omega-3 fatty acids have consistent evidence for reducing joint inflammation and stiffness, particularly in rheumatoid arthritis, but also in OA. 2 to 4 grams of combined EPA and DHA daily is the dose used in positive trials. Turmeric and curcumin have emerging evidence for modest pain reduction in knee OA. Several clinical trials show effects comparable to low-dose ibuprofen, without gastrointestinal side effects. Bioavailability is significantly improved when taken with black pepper. Collagen hydrolysate 10 grams daily has some clinical evidence for reduced joint pain, particularly in activity-related joint discomfort. Heat and cold. Heat, warm packs, warm baths increases blood flow, relaxes surrounding muscles, and reduces stiffness, most helpful before activity. Cold ice packs, cold packs reduces acute inflammation and pain, most helpful after activity or during a flare. Physiotherapy. A physiotherapist can assess movement patterns contributing to joint load, prescribe the most appropriate exercises, and provide manual therapy. For people with significant OA, a physiotherapy assessment is more valuable than any supplement. Footwear and orthotics. Appropriate footwear with cushioning reduces joint impact. Custom or off-the-shelf orthotics can reduce knee joint loading by correcting foot alignment. Topical treatments. Topical diclofenac gel has strong evidence for knee OA pain relief with minimal systemic absorption and fewer side effects than oral NSAID. Joint pain is not a reason to stop moving. It is often a reason to move differently. Exercise, weight management, anti-inflammatory nutrition, and targeted therapies offer a powerful arsenal of non-surgical options that can significantly improve quality of life. Surgery, joint replacement, is an excellent option when conservative management has been genuinely exhausted, but most people have substantial room to improve before reaching that point. As always, work with your doctor or physiotherapist to create a plan suited to your specific joints and circumstances. See you in the next video.